Hello, everyone. Thank you so much for having me today and allowing me to speak to you on this very important and up until recently somewhat elusive disease. Thank you to Dr. Sechkin and Padma and the Foundation for bringing it to light, and we're going to hopefully continue to do that. We have a great toolkit for you to use in your own practice, which is very important today that we're going to go over. So again, if you can take out your folders, and we'll get to that in just a little bit. I just wanted to let you know a little bit about myself. I am a registered nurse. For the past 5 years, I have been working in hospice. So don't get scared, because everybody gets scared when they hear that. But one of the things I think helps as a hospice nurse, you learn how to truly listen to people. You learn how to be available, to put your things aside and concentrate on the person that's in front of you. You also learn how to work as a multidisciplinary team. And for endometriosis, I think this is one of the most important things that we can take away today. We can't do it on our own, and we have to use other disciplines of medicine. We have to act together, we have to teach advocacy, and we have to help these girls who are coming up. It's a very holistic approach. We need to really make sure that we take that away from here. Again, because we are probably dealing with a population of young women who are going to have guardians, parents that need to be involved. Of course, that approaches the holistic care with their family. Again, we talked about spouses, significant others. Everybody is affected by this disease when there's someone they know and love that has it. I have a unique perspective on this disease as well, because I also suffered with endometriosis for most of my life, although I didn't know what I was suffering with up until recently. Without belaboring the point, because we've heard so many great testimonials today, I will let you know that, like Mackenzie, I spent most of my young life feeling isolated, sick, in a closed bedroom with dark, cold, throwing up, gastrointestinal problems, awful, awful migraines, horrible, just being isolated, physically, emotionally, mentally. So that's the other reason holistic comes into this, because this isn't just a physical disease. It really encroaches on and takes over your entire life. Through my whole career with this, if you will, seeing doctors, again, getting brushed off, getting put aside, being told that, yeah, you know what, you're not sucking it up. And girls, just that's what you put up with, you suck it up. Girls have been told this for a really, really long time, and I think it's kind of unfair. And we've also been meant to feel, you know, don't talk about your period, don't talk about these things. It's time we start talking about it. It's time we get this out and we tell these young girls, the school nurses, the nurse practitioners, anyone that we can tell. It is okay to talk about this. It is okay to talk about it, and here are the tools that you can use to make sure we open this conversation. Throughout my life, again, told that I had a low tolerance to pain, all these things that we've been hearing all day, I can relate to every single one of those testimonials. The thing that I feel is, again, important when we're talking to these young girls, we have to realize that there is a lot of kind of embarrassment with that. You know, these are private areas. We're always told that. So it's important that we allow them to advocate for themselves and tell them, if you are feeling this pain, then it's pain. Then it's real. It's not in your head. I was told that for a very long time. When I became a nurse, as a career changer, I became a nurse. So I thought I kind of maybe would gain some respect. And, you know, maybe somebody would really listen to me. It got worse. A nurse practitioner who had cared for me, my OBGYN nurse practitioner, cared for me for 15 years, at one point alluded to the fact that I was drug seeking. And it crushed me as a person. It crushed me as a nurse. She knew who I was. She knew what I had been through. And at that point, I felt so discounted and so left aside by the medical community that I had worked so hard to become a part of, and I was very proud to be a part of. So even on that level, if you can understand as an adult feeling that way, and to be told that after you are curled up in a ball dying, it's unbelievable. My husband, needless to say, deserves the Congressional Medal of Honor, the Purple Heart, and probably a Nobel Prize or whatever it is, because he's put up with me for 17 years. And he's a wonderful man. And throughout this, again, to see how he's been affected, how my parents, how my friends have been affected is incredible. And I've had amazing support on that front, so I'm very thankful for that. When I did finally give up on all this, I had gone to, we had gone through IVF because I was told I couldn't get pregnant. But then they told me I had this endometriosis. We're going to give you surgery. You're going to have a baby. Well, 4 surgeries, they cut nerves, they cauterized nerves, they burned endometriosis, no baby, still a lot of pain. It went on and on and on and on. I finally had to give up that dream of having a child. So I want you to be able to see that if we don't catch this early, it can result in incredible heartbreak. And that lessens a little bit over time, but it never goes away. So it is so vitally important that we are using these toolkits and getting these young women when we are able to treat this disease. So they don't, because when you're talking about a 12-year-old girl, that's another thing. We're going to talk about, I'm sure most of you who deal with these populations, how we speak to a 12-year-old girl about these toolkits and within using these toolkits is going to be quite different as to how we speak to an 18, 19-year-old girl. A 12-year-old girl is not thinking about her fertility. And we don't want to ever scare these girls any more than they probably already are. So when we're using these toolkits and we're opening this conversation, it's important to be age appropriate and to know what our audience is when we're talking to these girls. It's not necessarily, oh, you're gonna maybe lose your fertility, but we need to say this is something that is very treatable if it is something you have. We're going to help you, and it's going to save you a lifetime of pain and agony. And I think that, as I'm sure you all know, because if you work in this population, how we speak to these girls is going to be different. So I just wanted to give you that little bit of background on myself to let you know that it doesn't always turn out the best, but when I found Dr. Sechkin and he fixed me, that was the best thing. I kept telling my doctors, the male doctors who saw me and said nothing was wrong with me. I at one point was so frustrated. I told him when he grew a uterus and a couple of ovaries to call me and let me know, and I picked up my handbag and walked out of the office because I don't think anybody could understand. When I got to Dr. Sechkin, I walked in and pretty much demanded that he fix me, started spewing information, and he said, "Wait a minute, who are you? Well, sit down and let me talk to you. And what do you do?" And he looked at my husband and said, "So what do you do?" And I'm like, no, wait, because I was so afraid I was going to get cut off and dismissed, and I wanted him to hear everything I had to say. So this is the other point. We need to make sure that these girls are getting to people who are going to sit down and say, "Hold on, let me find out a little bit about you first, and who are you, and what do you do what's your hobbies?" And I was like, what? Did he just ask me what I do, like my hobbies? I can't believe it. Doctors were dismissing me left and right. These are all points that we want to address as we go forward with the toolkit. If you can please look ahead. I'm sorry, I skipped ahead on my own things there. We're going to pull out the actual endometriosis screening toolkit. And it is our suggestion that every girl you come in contact should be screened. We should be screening young women and girls just as we screen them for any other childhood and teenage and otherwise diseases. Again, we want to, when we do this and we present these surveys in a non-threatening way, to say, look, you may not have this, you may have it, and if you do, it's very treatable, but we're going to find out. I'm obviously not going to read directly through all these, but I just want to make some important points. We don't want to ask questions that are leading, and we don't want to add to the conversation as far as this is concerned. When we give this toolkit and we say, we want you to answer these questions, that's the time to sit back and listen. Allow the girl to express what her feelings are and what she's feeling. If we read into it too much or start suggesting too much, it may change their answers. And also, I think if we start using too much medical jargon, it might start to scare. So we just want to get their feelings on this first one. We want to emphasize the fact that it's a very treatable disease. And I like the fact that what we're using with this is consider endometriosis. Consider. we're only checking, we're only considering. We're not saying that you have it, but we're going to find out and we're going to help you. As Mackenzie and many of the others have given their testimonials, part of the questions is, in the past year, have you experienced so much pain around your periods you're unable to attend school, work, or social events? Allow them to give their answer if it's a yes or no, but then say, well, elaborate on that a little bit. Let me hear what your experience was with that. The heavy bleeding. We want to kind of say to them, you know what, if you can't make it through a class or an hour without changing your pad or your tampon, that's heavy bleeding, because that might be a question where it's like, well, what do you consider heavy bleeding? And also experience the recurring pelvic pain and explaining what that might be. At the same time that we don't want to encourage their answers, again, we never ever want to discount what they're feeling. So it's important for us to be active listeners, as we do, very much so in nursing. And also, just to mention, for the purpose of this discussion, we're speaking about girls who have already had their periods. Signs and symptoms have been identified in girls before having their periods, but we're kind of going for the middle ground here because that would take a different diagnostic tool. So this would be the first tool that you're working on and working on with the girl. The second page, if they're answering yes to one of these questions, probably something's going on. If they're answering yes to two or more of these questions, you want to go to the Consider Endometriosis tool. And for this one, not everyone will need guidance through this, and we were also kind of contemplating the fact that we might get more honest answers if these were given and then asked to bring back for a second appointment for the nurse practitioners who see patients. And then we can kind of go through it a little bit more then. They may answer more honestly if they have it, or they have time to kind of think about it and go over it a little bit. It's very important to stick to the script when evaluating the patients through this survey. Again, we want the answers to be honest and non-biased. We want to encourage their personal experience with this. Always, always, always. And I think it goes without saying because we're nurses, and you just want to show compassion. We all have things that go on in our lives, and we're always thinking about what's coming up next probably and how our schedule's crazy. But again, if there's one thing that I've been taught in hospice, and I've been taught a lot, it's that this is this person's life that's in front of you. It's so meaningful. If that was my loved one, I would want somebody to give them every ounce of their concentration and consideration and compassion. And especially when we're dealing with a younger population, it's such a confusing time. We have to make sure that we are giving them all this compassion, allowing them to know that we're truly listening to what they're experiencing and that we can provide help. We don't want it to be frightening for them. It's that really delicate balance between providing enough information to educate them and empower them without scaring them. On the Consider Endometriosis, you can see we delve a little bit deeper here, and the questions are a little bit more detailed, and we have the symptom check-off on the side. And I think this is nice and easy because they can just go down and check them off. I mean, if that's not the short end of the stick there, I don't know what is, because I think a lot of us can say you suffered with all that plus more. But it really shows that, yeah, there's obviously something going on here. If that right side is heavily marked up, we want to start to bring in the parents, talk about how we're going to start that interdisciplinary and that holistic approach with, all right, something's going on here. And if these, if they're kids, if they're under 18 and they're not on their own, we definitely need to start involving their parents and their guardians. Again, maybe the school nurses, maybe this is something that you can hand out, and when you do hand it out, say, this is something that when you go to your primary care physician, you want to bring this to your primary care physician. If you're answering yes to these questions, or you're finding that you're checking a lot of these things off, you want to share this with your doctor. And I think this is where it's important to bring the parents in, because we want to make sure that the parents obviously need to know that something's going on. But when you go to that primary care doctor, that's going to be the first line. So we need to say, take this with you. Now you're armed with tools. Now your doctor can't just say, nope, I'm dismissing you. Because here it is, and somebody else is looking at this. So I think it's very empowering to have this tool to have these girls fill it out and get there and say, but look, somebody told me that this is a problem, so I know it's a problem now. So now I have the knowledge, now I'm empowered. And now we're starting to open the conversation and let them know it's not something I need to be quiet about. If I have been quiet, I'm not going to be quiet about it anymore because somebody told me this is a problem, so I would like some help. So I think that's one of the great things about this. So nurse practitioners, when you hand it out, if you'd like to have them do it on their own, say, bring this to your next appointment. And school nurses, again, important to let them know, take this to your parents and take this to your regular doctor when you go for your appointment. And follow up. We do that in nursing all the time, right? It's not any good if we're not following up and seeing if what we're doing is making a difference or if there's follow through. So I think that's a really important part of this. Also, as always, we want to keep a copy of this for their charts. And again, I think it's just giving them armed with the tools and the knowledge they need. And I just want to look at real quick at number 4. I think that's a really important one, as we've heard from many people. I can remember, my mother never said, you're going to die when you have your period, it's going to be bad. She never said anything, but as a child, I watched that woman suffer horribly, horribly. And she got her period when she was 9 years old as well. So it was something, and at 40, a complete hysterectomy, and I don't think she ever really knew why, because they just took it out and said that was it. So it's so important for us to start delving in and knowing. If somebody would have asked me these questions, again, I would have been saved years and years of suffering and pain, and I might have been able to go on and have a child. So important that we're doing this. Okay, I'm going to move on quickly to this page, and I know it looks like a lot. Again, I am not going to belabor this by reading through every single thing, but I'd like to make some important points on this. This is a really good page, and at your leisure, everybody should read over this and know what's on it, because this is such an empowering page. One of the things I think giving this to the parent or guardian will help, because they can read through this and also understand more themselves and empower themselves to know, wow, I really need to be looking at these things, and I never thought of this. Educating the parents, of course, and the guardians is paramount, because when you have minors, that's the line that we're going to go through. Also encouraging the parents to advocate for their children instead of saying, I don't know, I didn't think it was that bad when I had my period. So it's giving them that education as well. This is very detailed, so we can provide you with the tools you need to have that knowledge. Let me see a couple of the things I want to mention on here. The family doctor or another trusted professional, which is in the first paragraph, again, take these tools to them. If there's not somebody that's addressing this and not trusting, you need to move and go and find somebody else, and that's really important. Someone who listens to you patiently, as I mentioned with what my experience is with Dr. Sechkin after being dismissed and cut off in mid-sentence. Somebody who listens to you patiently, who looks you in the eye, who's not looking at the watch and got a hand on the doorknob. Because it happens. As I mentioned, it's difficult for the doctor to ignore it when you have this in front of you and you're handing that to him. We want to understand that the details of this is not to diagnose, because this is not the proper way to diagnose, because we know laparoscopic surgery is, but this is the way to get toward that, to find that right doctor. What is the doctor's attitude about your role in healthcare? And I think this is for the nurse practitioners and the nurses. If you're working with a doctor and you're pointing this out to them, how is their respect level for you? If, again, as a healthcare professional, I felt that would gain me a little bit of respect, and in a lot of cases it did not. We should all have that interdisciplinary team, and we all deserve that same respect. It doesn't matter what credentials you have after your name. We're all here to help that patient. So we have to work together. If it's not somebody that's going to work with you, again, we need to move on to someone who will. Finding the right surgeon. As we also heard today, there's a lot of different treatments for endometriosis. Not all treatments are right for everyone. So it's important to know what treatments are out there, that there's the surgeries, there's the cauteries, there's the Luprons, there's all those different things, but important to find what's right for you. Many of the things weren't right for me until I found Excision. So it's important to know, be educated about the myriad of treatments that are out there and what will be right, what also will be age appropriate, because we're talking about a pretty wide range here. About the medication treatments, it's important as well as for that. I, like Padma, was just knocking myself out with anything I could, and happy to do it, because if somebody told me voodoo would work, I was ready to do it. So we need to understand that there is those treatments, but they should be monitored, because I suffered with migraines for years, so I had access to narcotics, and when I had this pain, I would do anything. I would do anything to get rid of it. Never rule out a second opinion or a third or a fourth or a fifth, because that's what it took me. And we need to tell girls, not just let them go out of the office and, oh, I'm seeing this girl in my office all the time. That should be raising up a flag. I don't see this girl in my class, or they're complaining of something that I've never heard about, but let me find out about it. Let me educate myself as a healthcare professional, and let me find out so I can help this human being. I think that's what it's about. I can't stress enough about this team effort, and it's a very, very complex disease. Dr. Wilson, the things that you mentioned were incredible, and I wish I knew those things. I wish somebody would have acknowledged me. Until I saw Padma's video, when I advocated for myself, I cried my eyes out. It was the first time I was ever validated, and I found out I wasn't crazy, although my husband might argue that one too. But it was, to know that it's okay that you're feeling those feelings and you're not crazy and you're not isolated anymore, and that somebody out there understands and can care for you. So it's so important to continue to advocate, to move on. And as nurses, if we're seeing that these girls are not getting the care that they need, it's our job to support them and to kind of steer them in the right direction and make sure that they're getting the care that they need. Somebody who really listens and hears, just as we do, because that's what we do. Again, please, I encourage you to read through this. There's so much vital information on this. We're going to move on to the personal pain profile. And as we know, individuals all learn differently. We each pick things up differently. Some of us are reading learners, some of us are visual learners, some of us like to hear things. It's all different. Sometimes people need all of those. So we thought we have kind of the survey, we have this, and then we're going to go on to the calendar. The pain profile, we made it so they can mark a P where they have pain during their period. They can mark an X where they have pain any other time of the month, or a C, where there's constant pain. Which was in my case. I was in constant pain. And if necessary, if they feel like they want to color code it, anything that works, this is for them to mark up as they please. I can't mention it enough, but we've heard it before. Pain is what that person says it is. Not any of us can judge another human being's pain, whether it's physical, emotional, mental, or all three. If somebody is saying they're in pain, they're not just saying it. And if they're trying to get attention, they're probably trying to get attention so they can get help. So again, we can't dismiss that. This is going to be, I think, a really great tool, especially easy enough for girls to just mark where they're having pain, and it can be all over. Moving on next to the calendar, and I'm sorry, I'm trying to zip through for you guys here. This we would start on the first day of their period. They would mark as day one, because we're going to go through this not as a monthly calendar, but as a cycle calendar. Again, we tried to make it as easy as possible, because when you're in that much pain and you're kind of miserable, the last thing you feel like doing is filling out paperwork. So this they can at least just check off. We did leave a little space for other, because as we know, there can be many other symptoms. These are pretty much the basic ones that we see a lot. Also, encourage your girls, if they feel that they need to keep a pain journal. If this isn't enough, get a little journal, and on those days, correlate them and say, I was feeling these things that I checked off, but I was also feeling this. And if they took medication, it's important to know what they're taking and how much they're taking. So they can really, if you want to encourage them to use a pain journal, it's probably a good idea too. And if they feel like doing that, it can be really cathartic and it can be great. And sometimes